Kidney stones usually make themselves known in the loudest, most dramatic way possible. The pain hits suddenly, out of nowhere, and feels like someone just flipped a switch from fine to oh no, what is happening? The pain tends to come in waves, intense, then easing a little, then building again. But it almost never goes away completely. Most people feel it in their side or lower back, and as the stone moves lower, the pain can shoot down toward the groin. What's surprising is that even when someone has every classic symptom, about half of them turn out not to have a stone at all once imaging is done. Doctors can often guess what's going on just by looking at the patient for a few seconds. People with kidney stone pain can't sit still. They're moving, pacing, bending over, trying everything to get comfortable. People with infections inside the abdomen, like appendicitis, are the opposite. They lie completely still because even tiny movements hurt. That difference gives a huge clue right away. If the patient is a woman who might be pregnant, the very first step is always a pregnancy test. This has nothing to do with judging the patient. It's because many scans involve radiation, and doctors won't do those unless they know the patient isn't pregnant. If the test is positive, a gynecologist gets involved. If it's negative, the team moves ahead with imaging. Once that's sorted, they often check the urine. Many people with stones have small amounts of blood in the urine. Sometimes you can see it, but more often it's only detectable on the dipstick test. But even this isn't a sure thing. A solid portion of people with kidney stones have absolutely no blood in the urine at all, especially if their pain started a few days earlier. So a clean pee test doesn't rule out a stone, and a positive one doesn't guarantee a stone either, because other issues like infections or bladder problems can also cause blood to show up. One of the most important vital signs doctors check is the patient's temperature. If someone has a stone and also has a fever, that's a big red flag. It means an infection might be trapped behind the blockage, which can become dangerous very quickly. In that situation, doctors jump into action with IV fluids, antibiotics, and sometimes a tube or stent to drain the kidney and relieve the pressure. To actually confirm a stone, the go-to test these days is a CT scan of the kidneys, ureters, and bladder. It's fast, incredibly accurate, and doesn't require contrast dye, which means fewer risks. It also shows other potential causes of pain, like appendicitis or aneurysms. Older tests like intravenous urograms and plain X-rays aren't nearly as reliable, and ultrasounds alone often miss stones. CT scans do involve some radiation, but newer low-dose versions greatly reduce the exposure while still giving excellent information. While waiting for scans, the priority is always pain control. Doctors usually use medications like diclofenac, which work quickly and help relax the ureter. If that's not enough, they add stronger painkillers. One thing people are often told, but that doesn't actually help, is to drink tons of water to flush out the stone. In reality, forcing fluids doesn't make the stone pass faster and can sometimes make the pressure worse. The exception is for a specific type of stone caused by uric acid, which can sometimes be dissolved with medications that raise the urine's pH. Once the stone is identified, the next question is whether it will pass on its own. The key factor is size. Small stones have a good chance of passing naturally within a few weeks. Larger ones might not. Most stones that are going to pass do so within 1 to 2 months. Doctors often watch the stone's position on repeat imaging to see if it's moving. There's also a helpful medication strategy called medical expulsive therapy, where drugs like tamsulosin are used to relax the ureter and give the stone more space to slide out. Many studies show that these medicines can increase the chance of passing the stone and reduce how long it takes. However, they're not used if the patient has a fever or kidney function is worsening. Some people, like pilots or anyone whose job can't tolerate sudden episodes of severe pain, may choose to skip waiting altogether and go straight to procedures like shockwave treatment or endoscopic removal. In the end, kidney stones are incredibly painful, but very treatable. The key pieces of the puzzle are recognizing the symptoms, getting the right imaging, managing the pain safely, and deciding whether a stone will pass on its own or needs help. And if there's one warning sign no one should ignore, it's having a fever along with that classic wave-like flank pain, because that's when waiting becomes dangerous and urgent treatment can be life-saving.